Live session by then. We are delighted. So Dr. Chinoy is here right now. So welcome to Health Live at Seniors today. We are delighted to have here with us Dr. Rajveer Chinoy, who you saw the montage earlier. He was there in our sessions in the past, and Dr. Shubhada Kalke. The topic that we are going to be discussing is arthritis care for seniors. I know it's a very broad topic, but we have done it in the past. I will also put the link to Dr. Chinoy's sessions that he's done in the past in the chat window in a bit. But before we request both of them to speak to you, I would introduce both Dr. Chinoy and Dr. Kalke. Dr. Rajveer Chinoy has graduated from the Grant Medical College and did his orthopedic training at the JJ Hospital. And after that, his MS in orthopedics. He trained at the Children's Orthopedic Hospital. He went to England in 1983. That was the time when the India won the World Cup, and worked in various specialized units around the UK for 12 years. He has undertaken arthroscopic knee surgery training in the UK and Singapore, as also a special trauma training in Singapore and Bangkok. His specialties are major trauma, joint replacement, and adult reconstructive orthopedics. Dr. Chinoy is attached to the Hinduja Hospital in Mumbai. And I must say here that we at Seniors Today are very thankful to Dr. Chinoy's. He's a friend of Seniors Today. He has helped us a fair bit in our Health Live session in the past. So we are particularly thankful that he is here with us once again. I would also like to introduce Dr. Shubhada Kalke. Dr. Shubhada Kalke is an MBBS from the GS Medical College and the KEM, which is KEM Hospital, and an MD in internal medicine from the Grant Medical College and the Sir JJ Group of Hospitals. She's a senior consultant rheumatologist and attached to the Shushtra Citizens Cooperative Hospital in Dadar and the Global Hospital in Parel. She has also been attached to the Leelavati Hospital in the past and the Fortis Hospitals. In 2011-2022, she started a rheumatology care and diagnostic center. She has published several over 24 national and international publications, 15 poster presentations in various national and international conferences, chapters and books. She's been a past president of the MRA. So we are particularly fortunate to have here with us both Dr. Chinoy and Dr. Kalke for this special session on arthritis care for seniors. Thank you and welcome to Health Live at Seniors Today.
Thank you.
Dr. Chinoy, can you hear us?
Yes.
Welcome, sir. How are you?
I'm very well. I'm very happy to be here. And I'm very happy that Shubhada agreed to give us a talk. So would you like me to, I will do my slides after Shubhada's done her talk.
All right, great. So over to you, Dr.
So Shubhada, maybe you can start and then
Okay.
I'll take over I'll be talking about the non-medical treatments for osteoarthritis.
So shall
After
I share?
Shubhada has introduced all her.
Yes, please start, Dr. Kalke.
Yeah, thanks.
Yeah, we can see your presentation.
Hello, good afternoon, everyone. It is, thank you very much for giving me opportunity to talk to you all on the occasion of World Arthritis Day. It is really a privilege to share and help. If I can help you, it will be great. Just before starting, let us first understand what is arthritis and what is rheumatism, as these terms are used very loosely. Or even local language, you use terms like vat and gathia. So what does it mean? Arthritis, arth means joints and itis means inflammation. So if you have appendix inflammation, you call it appendicitis. Similarly, if you have joint inflammation, you will call it arthritis. And rheumatism will mean all the soft tissues, muscle, ligaments, which are around the muscle. If they are painful, we call them rheumatism. And vat, in general, actually we have bought this term from Ayurveda. So from their angle, it is very different from what we call as Sandhivat. So for today's purpose, Sandhivat means osteoarthritis and Amvat means inflammatory arthritis or rheumatoid-like arthritis. And Gathia in Gujarati similarly will mean rheumatoid arthritis or Amvat, because possibly it has more swelling. So what are the types of arthritis? Now, if I have to go into this term, then I will be talking the whole of rheumatology, which is not possible. So broadly, we will divide them into wear and tear type of arthritis and inflammatory arthritis. And today we'll be covering wear and tear type of arthritis, which are most common at your age. So we'll be more talking about knee pain, which is the most common, back pain and neck pain. And if time permits, some other issues like heel pain, vitamin D deficiency, and osteoporosis. This is the joint. If you see, the joint has to comprise of two bones. Only then the movement can happen between the joint. So this is the knee joint. You can see that there is a femur on the top and tibia and fibula below, and there is a kneecap or patella. The joint is protected by a joint capsule, which is a protective lining. And inside the joint, there is a synovial membrane, which produces lubricant fluid, which helps to facilitates the movement. And the movement occurs because there are muscle around the joint. So when I fold this finger, it has to contract on this side and supported by muscles on this side. Only then I can hold it in this position. So it is supported by muscles and ligaments. You can see in knee, there is a cartilage and meniscus. I'm sure you must have heard these terms all along with your friends. So these structures basically support the weight bearing and shock absorbers and help the weight bearing of the joint. And when there is a wear and tear as the age progresses, you can see the cartilage and the menisci are the first one to wear, so that ultimately it will be bone on bone. And there are some fluid-filled sacs which act like a ball bearing, which are called bursae. So these are the various structures which can cause pain apart from the joint whenever you complain of pain. The commonest symptoms of osteoarthritis are pain, especially when you walk long distance or you climb stairs or getting down the stairs. Swelling and warmth and stiffness can occur occasionally. There are more features of other types of arthritis, what we call as inflammatory arthritis, but to some extent can occur in osteoarthritis also. And all pain, swelling, and stiffness can lead to restriction of movements. The factors, most of these are common sense. You know that when the age increases, it has more chance of developing wear and tear. Female sex has more chances. We see it all the time. Genetic factors. So some people are more prone genetically compared to others. So you may see, I am 70, nothing has happened to me, but he has
Voices now. I can't hear Shubhada.
Yeah, Doctor, I think she has, her connection has broken. We'll just wait for a minute. I'm sure she'll be back. Can you hear us, Dr. Shubhada? This is the problem with technology. I'm just calling her up as we speak, but not to worry, she'll be back in a minute. She has got disconnected right now. Yeah, I think we've got disconnected. Yeah. Oh, I don't think she even, because the screen size had reduced. So she's connecting once again. Those of you in the meantime who have questions for both Dr. Chinoy as well as Dr. Kalke, please put them in the Q&A tab. As always, mention your age and your gender, and then we will come back. We will pose these questions to both the doctors, depending on what your question is, and you can even specifically address it to one of the doctors, or we'll leave it open to them, both of them. Remember, as always, as I mentioned here, that these sessions are advisory in nature. Whenever you are looking for specific advice, it's always good to personally visit the doctor, and both Dr. Chinoy and Dr. Kalke will be available for teleconsults as well. Yeah, doctor, can you hear us?
Shubhada, you're back?
Yeah, she's back, but we can't hear you. We can't hear you, doctor.
Can you hear me now?
Yes, we can hear you. I'll just...
The problem is I have connected from my mobile.
Your camera is showing a different picture now, and the name coming under you.
Yeah,
is
that we will change. That will change. That will change. I think she has...
No, problem is because I'm my internet says suddenly locked out, and I don't know, I'm unable to connect to my internet. So I logged from my mobile.
No problem. No problem.
How do I share the presentation? Or I just talk? Or I'll email it to you? Or I can WhatsApp you?
Okay, Shubhada, you send him. See, now we'll have to do it in the reverse order. I will start playing my slides while you and Pradyuman sort out the technicalities in the background. Okay?
Yeah.
Okay, sure.
All right. So, Dr. Shubhada, if you can disconnect and try from there.
So if everybody's listening, there's going to be a little change in the program. Since there are technical problems with Shubhada's internet, I'll be talking about the non-medical treatments in short for different kinds of arthritis and different joints. And we'll go through that. And then hope by the time I finish, hopefully, Pradyuman and Shubhada will have sorted out the...
We will do that. We will do that.
Yeah. So
you can start. I will just stop the video. You can start, Dr. Chinoy.
Yeah. Can you see it now?
Yes, we can see it.
Right. Okay. So now let's go to slideshow. 1 minute. 1 minute slideshow. No? Yeah. Okay. Can everybody see the slides?
Yes.
Right. So I'm Dr. Chinoy and I'm at Hinduja Hospital. And what exactly are the non-medical treatments? The most important thing is patient education. Counseling the patient, explaining to them what the problem is and what things they can do to alleviate and relieve their pain, improve their mobility before we have to do any interference. So the important thing is dietary advice for weight reduction, exercises and physiotherapy. Now, the new type of physiotherapy is hydrotherapy. We also use steroid injections in limited cases and hyaluronic acid injections, which are injected into the joint, and they are lubricants for the joint and also help in cartilage repair. Obviously, weight loss for overweight patients helps with reducing the pain and effects of the arthritis. And then we will talk about the surgery in short. And there are various different types of things which can be done surgically. Now, the important thing is lifestyle measures. You have to adjust weight loss, avoid excessive exertions. You can take walks, but as long as you don't strain anything, don't carry very heavy loads, and work within your capacity. And between the flares, you should do exercises. When the pain is less, do regular aerobic exercises, use a walking stick, and wear appropriate footwear and well-cushioned soles to absorb the shocks. This is a simple set of exercises which will be taught to you by your physiotherapist. It will be there in the video, so you can do those when you practice it. Hydrotherapy is a very useful thing because you're weightless in the pool and you can move the joints without putting strain on them. Hyaluronic acid injections are available. These are chemicals which are injected into the joint to act as a reparative substance and a lubricating substance. And there are various brands. So it's not one particular brand which is better than the other, but it's important to know that it's useful in very early arthritis or in late arthritis. If the person is unfit to do anything else, it helps to relieve pain. This is another one also of hyaluronic acid. The surgeries involved corrective osteotomies, unicondylar knee replacement, total knee replacement, hip replacements, etc. So if you have a bone which is bent and the weight-bearing axis does not pass normally through the center of the joint, in the younger, active, and patients of normal weight who have a deformity, it's important to correct the deformity so you improve the weight-bearing axis, and that relieves the pain and helps to aid in proper mobility. So you can see the pictures here where a cut is made in the bone, it's opened and it's fixed with a plate, and the alignment, can you see my pointer? Then the alignment becomes straight because here it was crooked and here it's straight. So this is another, this is the varus, and you correct it and you put a plate in, correcting the axis. And this is another picture of the plate. Unicondylar knee replacement is if you have arthritis only in the medial compartment and you don't have to do a total knee, you do only a unicondylar, and it replaces half the knee. And this works very well. And it's compared to a total knee replacement, it's a smaller surgery, faster rehabilitation, little or no blood loss, with less morbidity, less expensive, less infection. It preserves the normal joint motion of the knee because the ligaments are all intact and the kinematics are normal. And it's a smaller incision and obviously less pain with short hospital stay and a quicker return to normal activities. For the very badly damaged joints, we have total knee replacement where you replace both the compartments, medial and lateral, as well as the cartilage of the patella is replaced. So this shows both the replaced knees, and we've also replaced the patella, as you can see. So all three surfaces of the knee are replaced with metal and intervening plastic, giving a good range of movement. The patient becomes pain-free and regains normal walking patterns. when you have hip arthritis, then the head of the femur gets avascular necrosis, you can have bisphosphonate therapy, or if the head is damaged, you can do hip resurfacing or a bipolar hip replacement. And nowadays we have something called dual mobility hip replacement and the long-standing reliable total hip replacement. These are all different therapies which will be explained to you when you visit your doctor if you have advanced hip arthritis. Fortunately, in India, we have not much hip arthritis, which is primary, but it's related to steroid use, painkiller use, and abuse of alcohol. And these have to be appropriately treated with counseling and lifestyle changes and therapy as required. This is just a slide on the types of therapy of bisphosphonates to help cure avascular necrosis of the head of the femur. These are the infusions on this. Is the infusion given once a year, and these are the weekly tablets which are taken. This is just to show what hip resurfacing is. This was very popular a few years ago, but it has lost favor because of the danger of metal on metal hips causing metallosis. And so it is not widespread use, but it has limited use in the younger, more active patients. Bipolar hemiarthroplasty is used when the head is damaged or fractured and the acetabulum is quite normal. There are also various dual mobilities where you have movement at two surfaces, giving a greater range of movement to patients, allowing them to sit on low stools and adopt various postures for religious purposes. This is a picture of a dual mobility where you have a metal or a ceramic head running on a plastic bushing, which itself moves inside a metal cup. And this is a standard total hip replacement where you have metal on the polyethylene and the polyethylene moves inside the shell. So you get one motion and a second motion, which is dual mobility. These are other hip replacements where you have metal on polyethylene, metal on metal, and ceramic on ceramic. So there are various models available and they are used depending on the patient's age, financial condition, and physical requirements. So the take-home message here is you must maintain an active lifestyle, keep your weight near the ideal weight, do regular exercises, avoid alcohol or any kind of addictions, and avoid the use of steroids if possible. Thank you. Now, how do I
Thank you very much. Thank you very much, Dr. Chinoy. We have been unable to get Dr. Kalke's computer up, but she has sent us a presentation, which now my colleague is going to play on the, yeah.
Okay, I'm back.
Yes. Hi.
Was it quite clear?
It was very clear and good and detailed. We're just going to get Dr. Kalke's presentation in right now in the next minute, because I have just got it. Doctor, can you see it? We can't hear you, doctor. You're on mute.
Yeah, can you hear me?
Yes, we can
Yes,
hear
we
you.
can hear you, Shubhada.
Yeah.
Now you
Thanks.
can follow on his slides.
Yeah. So I don't know how far you could hear. Did we finish this when I stopped?
No, you just started with the risk factors, and you
Okay.
were you were on genetic factors.
Okay. So we see around us some people who have problems, and some people even at old age are perfectly fine. So that can be due to genetic factors. Then obviously, if we are overweight, that puts more pressure on the knee joints, back, and you will have more problems early. If there is an injury to back or knee or any of the structures, then there is more tendency to get osteoarthritis. And overuse of the joint, especially work related, for example, people lifting weights day in and day out, and sitting job for a corporate workers in front of computer for a long time will have more back pains. People who are carrying weights will have more knee pains. People who have to walk more will have knee pain, and so on. And if there are comorbidities like stroke, diabetes related nerve problems, mobility issues because of comorbidities, other diseases, then again there is increased tendency for the osteoarthritis. Next slide, please. So what are the investigations that we do? Most of the time when we see you, we know that it is osteoarthritis. We do the X-ray to gauge the extent of the damage. On the left side picture here, you can see that it is a normal knee, whereas on the right side, if you compare, you can see there the space is reduced and it is slightly twisted. So that gives us an estimation of how much is the damage. Most of the times in osteoarthritis, we do not need blood investigations, but we still sometimes do basic bloods from the point of view of giving medicines to you, especially if you are in lot of pain and swelling, and I want to give you medicines like Voveran, then at elderly age, I want to make sure that your kidney function is all right. If I am suspecting any other arthritis apart from osteoarthritis, then obviously I may need other investigation like rheumatoid factor. If I am thinking of weakness, then I might do nerve studies. So other investigations are required depending on the diagnosis. Next slide, please. So these are all types of osteoarthritis. Tomorrow when you meet each other, you will, I'm sure, will diagnose all this all around you. The knee, which is like a bow, you will see most of the females, and you will see that they are walking with a twist. So, and if you can see the hand here, can you see the nodules and little twisted teda hands? So that is osteoarthritis, and a bunion in the foot. All these are part of osteoarthritis. Most of the times, hand and bunion do not require any treatment. Bunion, you may change your footwear, and you may wear support if it is causing you problems. But apart from that, most of the times, unless they are inflamed, we don't treat them. Next slide, please. These are, I have just given you the list of inflammatory arthritis or autoimmune arthritis. These are much different. There is usually more swelling, more stiffness lasting for more than an hour, and they have definitive different treatments, but it is a huge topic which we will not cover today. Next slide, please. The treatment, though people believe that we allopathic doctors give painkillers most of the time, if the pain is acute, then first you will like to give rest, not for a long time, maybe 1 or 2 weeks maximum. Avoid extreme of positions like Padmasana and Vajrasana in yoga when you are in pain. Support you can wear temporarily. Make sure you are not permanently on the support, because that will ultimately weaken your joint, but you can wear it if you have inflammation when there is difficulty in walking. The commonest question is, when should we use heat and when should we use cold? So one thing is that there is a personal preference. Some people prefer heat and others prefer cold. Some people even prefer combination of heat followed by cold. Generally, if there is an injury, we tend to give cold fomentation. And if there is a muscle spasm or
strain, we tend to give heat. The physiotherapy modalities, the machines are not used usually in acute phase, but in back pain, you can use ultrasound to reduce pain a bit. Exercises by far are most important to maintain mobility, strength, and balance. And though I have given it as one of the last, I think for long run, not in acute case, but for long run, I should be just saying exercise, 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 and exercise. Even if you have to go for surgery, after that, you will need exercise to get back to normal. And obviously, if you continue being overweight, then again, it is going to put more pressure. So factors like reducing weight will be important. Next slide. Painkillers, as I said, if you come with lot of pain and swelling, then sometimes we do need give anti-inflammatories like Brufen and Voveran. These are the commonest. There are many more, but I have given you just common names. But as I said, we need to make sure that your kidney function is normal and they can't be taken indefinitely for a long time. So most of the times we prefer to give simple paracetamol, tramadol, and muscle relaxant depending on patient's preference and the problem that they have. We can also give local therapy with gels like capsaicin and again Voveran and other anti-inflammatory gels. Glucosamine and chondroitin, they are not painkillers. They have much less side effects. They do help in stabilizing the cartilage and they can be given for up to 6 months to a year very easily. So they do help a lot in these situations. In certain situations, we used to use diacerin, especially with little inflammation, it used to work well. And even now we use HCQS. You must have all heard HCQS after COVID, I guess. So we do use it if there is a swelling in inflammation, even in the hand joints, knee joints. HCQS tends to help quite a lot. Dr. Chinoy has already covered joint injections. Next slide, please. Hip osteoarthritis is rare in India. It may be increasing due to our sedentary lifestyle and reduced squatting. And it is more common with other forms of arthritis like ankylosing spondylitis and rheumatoid arthritis. Next slide, please. Avascular necrosis of the hip, you may have heard. It happens when you get sudden cutoff of the blood supply. It is more common with glucocorticoid use, alcohol abuse, and injury. We have to stop the causative factor and use of bisphosphonate, and if that doesn't work, then surgery. Next slide, please. Back pain is another very common. The reason I have given you this picture is just to show you from neck to back how many muscles are there. And if you can see, some of them are quite big muscles. Human are the only two-legged animal. And because of that, we tend to produce a lot of pressure on our spines. So our big muscles help us, but they can produce problems also. Next slide, please. Again, these are the postures. You will see when you look all around you, you will see these postures. And the problems with the posture, if the person is very straight as in the second one, or when most of the times when we are working on computer, you will have neck problems. Your neck will come forward and thoracic spine, there will be curvature. So all these factors, again, you will see these kind of postures all around you, and they can be the cause for the pain. Next slide, please. Another common problem which you all must have heard is a disc problem. You must have heard about prolapse disc. So as age increases, the water content of the disc goes down, and sometimes it is like a tooth. You know, when outer part of the disc is thick and the inner part is soft. So when the disc ruptures, you can see like a toothpaste, it comes out, and the inside where you can see it can actually, there is a cord. So it can produce pressure on the cord this way. And when the disc comes out, there can be thinning of the disc causing wear and tear. Next slide, please. So in this is the typical X-ray. You can see wear and tear, osteophytes. I'm sorry, I'm unable to show you, pinpoint to you at the moment.
If I move my cursor, does it show?
No, it won't show then.
No, okay.
No, it won't show there.
All right.
Next slide, please. What I have underlined, you can see the disc prolapsing in the MRI, and you can see the red part, red moon-like thing is the pressure of the disc. The above one is the disc, it is causing pressure on the disc. You can see how it has pressurized the cord. Next slide, please. So these are the exercises. What I want to tell you is watching YouTube videos and is not enough. You must make sure that you have learned them properly and you are doing them properly. And whenever, for example, when there is a knee problem, you have to make sure that your gluteal muscles and abdominal muscles are strong as well. So all these exercises you have to learn. Next slide, please. So physiotherapy is the best bet to make sure that you are learning them correctly, and physiotherapists also cannot teach you all exercises in one time. So you may need a few sessions gradually as you improve. Next slide, please. So these are the example of knee, back, and neck exercises. Next slide. I think should we stop here and wait for question and answers?
You could take another. Yeah, that's fine. I think we are at 5:40 already, so
Yeah.
and quite a few question and answers. Questions.
Yeah, sure.
So, but before I continue, yeah.
I want to show this. This is what Shubhada mentioned about chondroitin and glucosamine. You get them in various brand names, but these are very useful for hip and knee arthritis.
Right. Thank you. So before I start with all the questions, I'm going to put the link of Dr. Chinoy's past sessions in the chat window. So those of you who would like to refer to them, please do that. Also, as always, we will have the edited video of this session, as well as takeaways written by a qualified medical practitioner, which will be put up on the Seniors Today website on Monday evening. So those of you who may have missed taking a screenshot of the various exercise positions and or taking a screenshot of the medicine that that Dr. Chinoy just showed, you can watch it once again on the Seniors Today website on Monday. Having said that, I'm going to start taking the questions. So this is a question from Mr. A.K. Chopra, who is 73. He is suffering from knee pain in both legs, but the right leg shows a deformity. He does regular exercises, yoga, cycling, walking for 1 to 1.5 hours. His question is, how can he avoid a knee replacement? Dr. Shubhada, would you like to take it?
Shubhada, please take that.
Yeah, I'll take that. I would like to ask, how much is the pain if there is a deformity?
We'll have to wait for that to come.
Okay.
But anyway,
okay, let me answer. It depends on how much is the deformity and how much is the pain. And secondly, what is the cause of the deformity? So doctors generally, when they assess you, they will look at that. If the pain and deformity is not much, then obviously you are continuing with all your exercises. So you are happy to continue the exercises and make sure your strength is good. Secondly, if the pain is too much, then but that I don't think will be the case, because you are doing cycling, walking, everything. You must try with the physiotherapist if you can correct the deformity, if it is possible, because if it is possible, that will reduce the chances of need for surgery and further damage.
Right. Thank you.
And you can try glucosamine chondroitin in the meantime.
Right.
Yeah. Also, could I ask?
Yeah, sure.
Has the person met an orthopedic surgeon and have they quantified the deformity? And have they had X-rays done?
Right. So, in case you haven't done that, please do take it Mr. Chopra. And in the meantime, I have a question from Mr. Brijendra Kumar, who's 79, and he is from Mumbai. He asks, is there any alternative to knee replacement? He says, my left knee is a problem, wear and tear of cartilage, but crackling sound is not there, only pain in movement.
You want me to take it?
Yes,
Yeah, go ahead.
please.
Yeah. So as we already mentioned, depending on whether there is inflammation, one can use glucosamine chondroitin. There are collagen substitution also, which one can use. And if there is an inflammation, one can use hydroxychloroquine, and we can see how much it helps your pain. And again, as I said, whether you are doing exercise, whether we have corrected your deformity, we also must check if there are any bursae. What is the cause of pain? Is it joint or it is around the joint? So if we look at all these things, then one can help you. The another thing which I just want to bring it to your notice here is that need for knee replacement is we try to help your lifestyle. What Dr. Chinoy is doing is helping you to be mobile and do most of the things. Now the question, what is your idea of mobility, is you have to answer. Because I'll give you two examples. There was one person who was really disabled, but he was hell-bent on saying, I don't want to do anything more. I'm happy with what I'm doing. So obviously there is no need for surgery. But there was another gentleman who was 80 years old, whom I tried to treat conservatively. And he met me after 6 months and said, Doc, I want to go on a trek at the age of 80. And I'm unable to do that. So can you help me? So I said, okay, in that case, and he said, I would prefer to be mobile. So I want knee replacements done. So what is your idea of mobility is also important when we decide, or Dr. Chinoy or we decide to help you in whichever way.
Right. Thank you.
Yeah. Can I just add to that? Knee replacement is the final option. It is to be used when the pain cannot be controlled by medications, physiotherapy, using a stick, and you've used injections, etc. And if you want an active lifestyle and you don't have any relief with any other modalities, that is when you should think about having knee replacements. So there are strict criteria which should be followed by the doctor and the patient. It is not something to be taken lightly. You have to be in good health. You have to be near the ideal weight. You should have used all other modalities first. And if you still cannot carry out your daily activities and you have night pain, etc., then we think about doing surgical management.
Very well said, Doctor. We have a question from Dr. Chinoy. A question for you is Marjorie Fernandez. She's 76. She says, I don't have any pain, although I have osteoarthritis of the knees. There's swelling around the knees most of the time, but I don't bother about it or take any medicine. As I'm already 76 and my leg bones are strong enough, I think it's best not to interfere with surgery and injections. What medicines would be suitable for me, given my situation?
Now, Marjorie, you mentioned that your leg bones are strong enough. Have you done a bone density check? That's number one. If there is swelling around the knee, then like Dr. Kalke said, that there might be some amount of inflammation. Now, you might benefit from taking mild painkillers. You will benefit from taking chondroitin and glucosamine supplements. If there is inflammation, you could use hydroxychloroquine and do exercises, strengthen your muscles, keep active, and then see how you go.
Thank you, Doctor. And as I have always maintained in every session, there's no solution to meeting the doctors yourself personally whenever you can. Both Dr. Chinoy and Dr. Kalke are based in Mumbai, and you can always visit them. And of course, you can also do a teleconsult with them, or in the city and town that you are there, you can meet somebody appropriate. Doctor, Doctors, we have a question from Mr. Suresh Khatke, who's 71. He asks, is vertigo problem connected with neck pain? And although he has no neck problem, in spite of exercises, walking, he gets vertigo at least.
Where is that question? I can't see it. What's his name?
Suresh Ghate, who's 71.
Okay, yes, I can see it, yes.
He has a vertigo problem that is connected. He wants to know whether vertigo problem is connected with neck pain. He has no neck problem, but in spite of exercises, he gets vertigo at least a few times a year. What are the remedial measures and precautions to be taken?
No, there is some Marathi in that. I don't know. I get
at least Twitter a year. But I don't know what he means. Perhaps
what is Twitter a year?
Yeah, we don't know that. But anyway, we could.
But I think, Mr. Ghate, I would suggest you have a consultation with your local neurologist and see what they have to say. And then you could also go and meet an orthopedic or a spine surgeon and let them look at it and then decide.
Right.
Now, there's an interesting question from Prakash Jagtani. Can glucosamine, sulfate, chondroitin, MSM, and collagen help in backaches? Your back will have to be assessed, but these are more for cartilage joints. Okay. And yes, glucosamine and chondroitin are known to increase the sugar levels. So it should be taken. There was another question also. Can I start taking the medicine without showing a doctor? Somebody had asked.
That's right.
So please don't start any medicines without seeing a doctor, having a proper consultation, and a prescription for the medicines.
Right, absolutely.
Neha Bobde has said, I'm 54-year-old, was just diagnosed with osteoarthritis 2 months ago. Please suggest treatment and medicine. Now, Dr. Shubhada and myself, we have elaborated this during the talk. If you joined a little late, then maybe you could see both the talks in the edited version next week, and your questions will be answered. But again, I reiterate, please go and see your local rheumatologist or orthopedic surgeon.
Right. Thank you, doctor. We have a question, and this was, Dr. Shubhada, you had mentioned this, but Girija Ganesh asks, when do we use the hot pack and when do we use the cold pack? In case of swelling, pain, and numbness, could you once again talk about that?
Sure. There are two things to it.
I think we have lost Dr. Shubhada once again. We'll wait for a couple of seconds.
Can you hear me?
Yes, we can hear you.
Yeah, a hot pack is usually used if you have muscle pain and muscle spasm, because it increases the local temperature, increases the blood flow, and it helps to relax the muscle. We use a cold pack if you've had a strain or an injury, and you've fallen down, you've bumped yourself, things like that. Now, so if there's swelling and pain after an injury, use a cold pack. If you have muscle pain and spasm, I would suggest you use a hot pack. But if you have numbness, it needs to be assessed by a doctor. Now, there's an interesting question by Ravi Gandhi. He's 61 and he has started getting pain in the knee while climbing steps and when he's doing long walks. This is known to be due to patella pain. That is the pain in the kneecap. So this is probably not arthritis, but the strain on the kneecap. So, you need to be assessed. We need to know your height, your weight, your muscle condition, and you need to know if you have arthritis by taking X-rays.
Right.
And the usual thing may be just patella pain. So medications and physiotherapy and exercises will help.
Right. Thank you very much. We are running out of time.
And Mr. Agarwal, S.K. Agarwal, 76, had an injury many years ago.
Right.
I think it must have been a tibial plateau fracture.
He had an injury in tibia, yeah.
And he says, can I wear a kneecap and how long during the day? How long during? Now, a kneecap, you can wear it when you're standing and walking. When you're sitting down, lying down, or sleeping, please remove the kneecap. The kneecap is generally to be used when you are standing and walking.
Great. Thank you very much, Dr. Chinoy, and thank you, Dr. Kalke, for spending quality time on a Saturday evening. And
sorry about this internet mess.
this is the way it is. With technology, it happens to us also very often. But of course, you have the presentations. The entire edited video will be up on the Seniors Today website on Monday evening, right? That is Monday the 16th evening. It will be there on the website, and you can have a look at that. As always, we will be back with Seniors Today Health Live at Seniors Today. It happens every Saturday, and we will be back with another session soon. Once again, thank you very much for being here. And Doctor, we would just request you to give us 1 minute. Our latest issue of Seniors Today, the magazine, is just out, and I'm going to ask our producer to play a video of that thing. It's a special cover story on Wahida Rahman, who's just got the Dada Saheb Phalke Award. And Firoz, I can't see it. Thank you very much. So this is issue 52 of Seniors Today magazine. As you know, these magazines are available free of cost, and you can read them. They are all there on our website, that is seniorstoday.in. You can download it and read it at your free time. Once again, thank you very much, Dr. Chinoy. Thank you very much, Dr. Kalke, for being here and explaining in detail your various details about the arthritis and about various forms of treatment. One question I have for you is just come in, and I want to take this question. You mentioned about exercise, etc. What about things like acupuncture and acupressure, etc.? Are these also advisable to look at, Dr. Chinoy?
I'm sorry. It's difficult for me to answer that because that's not a modality we have ever learned about or got into discussion about. Acupuncture is a completely different subject, and there's a lot of knowledge in the in the books and there are practitioners, but I wouldn't comment on it.
Absolutely. Thank you very much. I think that's
It was our pleasure to give the talk. We should have had a little more time to answer people's burning questions, but I'm sorry, Dr. Kalke had some technical issue, but it was a pleasure to hear her. Thank you very much for inviting us.
Thank you very much.
Thank you very much. Thank you.
We will be back again very